I'm Dr. Pramod Reddy Kandapure. I'm the Chief Cardiothoracic and Aortic Minimally Invasive Cardiac Surgeon in Medicover Hospital, High-Tech City, Hyderabad. I will discuss now regarding aortic aneurysm surgery. So what is aneurysm? Aneurysm is the expansion, the tube, aorta. Aorta is a tube which comes out of the heart, which supplies blood to the whole body. So that tube, it is called aneurysm when it becomes double the size of the normal size. So normally it is 2.5 to 3 centimeters. If it becomes like 5 to 5.5 centimeters, it is called a severe aneurysm where the intervention is required. So there are different places where the aneurysm can form. One is the aortic root aneurysm, ascending aorta, then arch aneurysm, and the descending aorta aneurysm, abdominal aortic aneurysm. So these are the different places where the aneurysm can form. Why the aneurysm forms? Sometimes it is genetic because of some chromosomal abnormalities which causes collagen vascular disease. The other cause is atherosclerotic, or due to old age the aorta becomes weak, and which is the hypertension is one of the predisposing factor for aortic aneurysms. So what surgeries are done for aortic aneurysms? Previously, aortic aneurysm surgery were considered a very high risk surgery, but now we are carrying this aortic aneurysm surgery very frequently, and the risk of the surgery has come down. So the commonest surgery which is done is the aortic root surgery, where the root of the aorta becomes dilated and the valve also becomes weak, and sometimes it starts leaking, or in some patients we see that the valve has become tight, that is aortic stenosis it is called. So in that cases we have to replace the aorta as well as the valve, that is called a Bentall's operation. Bentall surgery is a common surgery which we do in aortic aneurysm. We replace the aortic valve as well as the tube. Ascending aorta is replaced in these patients. So sometimes we have to replace the arch. Arch surgeries are the very complex surgeries because we cool the patients to 18 degrees Celsius, and we put some tubes in the neck vessels which supply blood to the brain to give blood during when we are cooling. So we do the surgery, and then once the surgery is finished, we start rewarming the patient. So during this procedure, only the brain gets blood supply, the whole body is completely cool. And then once we finish the surgery, we start rewarming, and then the heart starts beating, and the patient also is rewarmed. So the third types of surgery is in aortic aneurysm is descending aorta surgery. So descending aorta surgery are still complex surgeries, and it's not like isolated only one descending aorta or arch of aneurysm is present. Sometimes we see that both the arch as well as the descending aorta aneurysm also is present. So in those cases, we used frozen elephant trunk, which is the recent advances in cardiac surgery, where we have a tube with a stent. So both the combination of that we can use it. So arch replacement we can do it, and we put a stent in that one in the descending aorta. So this is like a one stage. Instead of doing a two-stage surgeries, we can do a one-stage surgery of arch repair as well as a descending aorta repair. Then the fourth surgeries are descending aorta, where we go from the left side of the chest and then we replace the damaged part with the artificial tube, which lasts longer. When we use a tube, especially in the young patient, it will last longer. The other options in the descending aorta are stents, but those options are for older patients who are not fit for surgery. First choice always is the replacement with the surgery with using the new artificial tube. The abdominal aortic aneurysms also are another disease where we have to replace the part of the aorta with the tube. So we cut in the abdomen down, and then we replace the part. So this is regarding aortic aneurysm surgery. The second surgery which is commonly done in aortic patients are dissections. There are different types of dissections from where it starts and where it ends. So the first or commonest type is type A dissection, which starts from the ascending aorta and it goes down all the way. The type B dissection is which starts from the beyond the subclavian artery and it goes down the way to the common iliac and internal iliac or external iliac. The third type is retro type B dissection or retro type A dissection it is called, where the dissection flap starts in the descending aorta after the subclavian, but it goes into the arch or ascending aorta. But arch and ascending aorta, there is no tear in the aorta, only the flap is there. So these are the three common types of dissections are there. Type A dissection and retro type A dissection are surgical emergencies. We have to do surgery as early as possible because the mortality is very high if we don't do surgery. Like 25% of the patient die in one day, 24 hours. 50% of the patients, they die in 2 days if we don't do surgery. So this is very complex surgery. Even after surgery mortality also is high. surgery mortality is around 10 to 15%, but if we don't do surgery, the mortality is very high. So that is the reason these surgeries are done in emergencies. And it depends upon what is the extent of the disease, we have to do surgery. If the disease is only involving the aorta and the ascending aorta part, usually we try to repair only the part where the dissection flap is there. So we just replace the ascending aorta and then we see in the future follow-up we do it. But if the arch is involved and neck vessels are involved, and then we can use the elephant run technique. But most of the times we try to do it just ascending aorta repair, and then in the future if the patient requires any surgery, we do it. Coming to the type B dissection, which is the distal part of the dissection part, distal to the subclavian, the dissection happens distal to the subclavian artery. In that part, the first choice is always a stent because the tissues are very friable. So the patient has any symptoms or patient is continuously having a chest pain and BP is not controlled, then the stent is better option. Otherwise, if the patient is asymptomatic, we just give treatment for controlling the blood pressure and the pressure gets under control. And we manage him conservatively and then keep him on follow-up. So sometimes if the patient has a big like aneurysm and then it follows a dissection, then sometimes we do surgery, but surgery is a third option in these types of patients. So aortic aneurysm surgery in short is done for aortic aneurysms and it's also done for dissection. It is very high risk surgery, but advances have been there in the aortic aneurysm surgery where we have brain monitoring instruments or equipments are there. We give retrograde or antegrade cerebral perfusion during the cooling, and we have some sophisticated heart-lung machine. Plus, in descending aortic aneurysm, sometimes we have to do spinal fluid drains or CSF fluid drainage. So those facilities also are available. Nowadays, the mortality has come down, or morbidity also has come down, which used to be in the previous times. So present situation, we can do aortic aneurysm and dissection surgeries in our hospital with good results and good facilities are available.